Good morning. So the WHO have declared a resurgence in monkeypox as a public health emergency of an international concern, right? Of international concern. If you remember, I think it was nearly a couple of years ago, they floated this monkeypox around for a bit. And then stories started coming out that it might not be that it can be spread through sex. It might actually be a sexually transmitted disease, and there's a difference there, right? So then there were stories of a French homosexual couple had seemingly passed this monkeypox onto their greyhound. Then other stories started coming out. I think there was 30-something cases of monkeypox found in children in America. And then bang, the story disappeared because it became a bit of a joke. It became a meme. In real time, it became a meme. People laughed at this stuff. And they were pushing it and pushing it. And now it's back. But they dropped the monkey. Now it's just Mpox. Same idea. So they're speaking of a resurgence of cases in Africa. Okay? Not much to do with Ireland. Other than the fact that we're importing tens of thousands of men from Africa. Which turns this thing from a joke into a pretty serious question. If monkeypox does turn out to be, as it has been long argued to be, a sexually transmitted infection or disease, whatever way you want to call it, and we're seeing a rise in cases of this, then are we looking at something that is a lot more sinister than just catching nits off somebody from being too close to them or using the same hairbrush as them? Because if you recall, and look at, I suppose, the beauty and the weakness of how we live in the current day is that news doesn't come in a fully elaborated story, a coherent story where sense is made of all the parts, right? You get the parts sporadically, and it's up to you to piece these things together. Okay? So we may be seeing a rise in monkeypox, but what we are also seeing is a rise in chlamydia and other sexually transmitted diseases like HIV, which coincide with the new arrivals here. So Africa, pretty well known, the HIV cases pretty high, substantially high there, right? And now as we import these people, our levels of these cases rise, along with cases of sexual assault. Okay? Which again, these news stories are released sporadically. You can chain them together yourself. It's not that hard, if you want to. It's only hard if you don't want to see it, right? But on the point of, we bring in the WHO and Tedros, right? Because we look at what his accomplishments have been over the last 5 years or whatever. We'll cut it at the 5, right? So he loved lockdowns. He wanted to lock down the whole planet because everyone was going to die immediately. They didn't, right? They didn't. We didn't. Many did, though, but maybe not as a result of the thing that he was pushing, or the virus that he was pushing. Maybe as a result of the cure that he was pushing. Right? So, for those of you who walked hand in hand with Tedros, who's the president of the WHO, who put on your masks and applauded the dancing Gardaí and the dancing nurses, who always seem to be in empty hospitals with plenty of time on their hands to choreograph these dances on a national scale. When I watch that, I see them laughing at me, or laughing at those who bought into it, right? But so we have the level of people coming here is increasing, nearly exponentially. You could call it open borders if you want. You can quibble over the terminology if you like. But it's easy to see that it's pretty easy to come in here. You're welcomed here. You have ministers in the Dáil telling you that if you come here, I'll give you a free set of keys, and you'll have a house, and we'll get you a little job immediately. Probably not the job you're thinking you were getting, though, right, Roderick? But if you look at, those who followed all this stuff. So we go from lockdowns, people terrified, petrified. Still at it, still going around with masks on and afraid to talk to people, nearly jumping off footpaths and you pass them, right? So they demanded lockdowns for our safety. They demanded that the government take a strong stand against this and beat back this virus. So they were okay with destroying your life for a few years. And then all of a sudden, without any official statement on it, everything is open again. And now we need to bring in tens of thousands of people. We really, really need that for everyone's safety. They don't need to be vaccinated or anything like that. You do, not them. They're fine. Okay. And now you have this new thing, this Mpox. It's not really new, they just changed the name. Mpox, Monkeypox. And he's saying, the WHO are saying that it's of international concern and that it's a new health emergency. So for those who were calling for lockdowns and they were happy to disrupt my life, are you going to be calling for lockdowns now and the stopping of the importation of these people from these hazardous zones? Because many of them are coming from Africa. That's where the resurgence of monkeypox is. So, are you calling for lockdowns now? Yeah, I hope you do, because at least be consistent, because otherwise you look quite the fool. But look, in all seriousness, they're trying this again. I think Donald Trump said it, and it makes perfect sense. 2020, lockdowns, why? Keep people away from voting in person. You had the postal ballots then, mail ballots. You could send in your ballot. No need to identify who you are. 2024, next election, oh look, we've another international emergency. Lockdowns may be needed again. Are you buying that, really? Really? For what looks like, for what looks like a sexually transmitted disease. Crazy. And Ireland and people will go along with it again, and they'll tell you to your face and you talk about it, Mash, it's a big load of nonsense, isn't it? Why are you doing it then? Why are you following what you've been told to do? Sure. The last words of the dying Irishman. Sure.